February is American Heart Month, and taking care of your heart is key. Why? Well, heart disease is the leading cause of death in the United States and worldwide. It's also the leading cause of death for most racial and ethnic groups. In this Closing the Gap segment, the American Heart Association joins me to discuss ways you can help prevent heart disease. The month of February is designated as American Heart Month. The goal is to raise awareness about heart disease, which is the leading cause of death right here in the United States. Joining me is Jennifer Hopping with the American Heart Association to talk a little more about the disease and ways to combat it. How are you?
I'm great. How are you?
Thank you for joining me.
Yes, thanks for having us. It's a big month for the American Heart Association.
Okay, talk about what is heart disease.
Well, heart disease is anyone that's been affected by any heart-related illness. You've got, of course, heart attack, stroke, hypertension, also all the comorbidities that go along with heart disease, such as diabetes, obesity, high blood pressure. So many things play into heart disease. And unfortunately, that's why it's America and Mississippi's #1 killer.
Wow. And give me some statistics right here in Mississippi. How are people in Mississippi affected?
Well, we are heavily affected, unfortunately, because a lot of the comorbidities that I just named are very high in Mississippi. And so many of the things that we can do in our lifestyle can help prevent heart disease. That is one good thing that all cardiologists will tell you, is there's so many things you can do to change your lifestyle. And 80% of heart disease is preventable. So there's a lot of things that you can do to take control of your own health.
And before we talk about that, do you find that people tend to suffer due to their zip code, meaning in rural areas when it comes to heart disease and even stroke?
Absolutely. So the American Heart Association really looks at the things that people face in their communities, such as access to healthy foods, access to health care, safe streets, being able to walk and exercise. So we know that so many of those factors play into the overall statistics of heart disease.
And how does the American Heart Association help combat these issues? And people who are suffering from heart disease, how do you help them as well?
First of all, we have a lot of educational awareness opportunities on our website. We also provide education to hospitals and doctors. They follow the American Heart Association guidelines when they are treating patients with heart disease.
And heart disease is not a death sentence. What can people do to prevent it? And those living with it, how can they continue to combat it and fight for a healthier lifestyle?
Yes, years ago, heart disease was a death sentence. Many people that suffered heart attacks died. Now we are saving lives. You know, we have so much come so far thanks to research funded by the American Heart Association in the treatment of heart disease and stroke. But there is so many things that we can do. The American Heart Association talks about our life's essential 8, and that's just 8 areas of overall healthy living that people can be aware of. You know, things I've already mentioned, your blood pressure, your blood sugar, your weight. Do you exercise? How do you eat? One thing we just added recently is the importance of sleep in overall health. We know that people that don't get enough sleep, that can also lead to heart disease.
All right. And I know we're celebrating American Heart Month, but this is something that can continue throughout the year. How can people help the American Heart Association, either with volunteering or fundraising?
We can't do our work without funds, and it's so important. And we have so many people and businesses that join with us throughout the year to help make all of the work that we do possible.
We, of course, have to wrap up this interview, but please talk about the importance of going to the doctor, staying healthy, and paying attention to your body. I know many times we're busy and we're doing things, work, life, kids, and we forget that we need to be healthy in order to help other people.
I say all the time, and most physicians will tell you, that we have to be advocates for our own health. We have to take ownership. If we don't feel right or if something just doesn't seem good, we've got to go to the doctor. I think knowing your numbers and being aware of your cholesterol and your blood pressure and make sure that you're managing that. It's just making sure if something doesn't feel right, speak up, go to your physician. If you don't have a physician, I encourage everyone to find one that they trust, that can help them manage their health. Because as I said, heart disease is largely preventable. And so the more we know and the more we can manage that, the better outcomes.
And if people want to get in touch with the American Heart Association, what should they do?
Yeah, so our website is heart.org, and you can actually find a local office. Our office in Mississippi is here in Jackson. We would love people to reach out if they're interested in getting involved. We also have wonderful social media pages, American Heart Association Mississippi. You can find us on all social media channels there. Without a healthy heart, obviously you can't live a healthy life. The heart is the center of everyone and all that we do and all that we love, all those that we love. We have to make sure we keep a healthy heart so we're here for the future, for our families.
Awesome. Thank you so much for joining me.
Thank you. We appreciate you having us.